let us understand the MCA anatomy. Now, why am I trying to talk about MCA? Because MCA is one particular
arteries are the lenticulostriate arteries. So you can see this bunch of branches over here. These are the deep penetrating arteries or the lenticulostriate arteries. These end up going and supplying the posterior limb of the internal capsule, the putamen, the outer globus pallidus, a major part of the caudate nucleus. Okay. Then what happens is the middle cerebral artery, it travels in the Sylvian fissure and divides into the superior division and the inferior division. So this is the superior division and this is the inferior division. So this two segment, or these are the two M2 branches of the middle cerebral artery. Okay, so the MCA superior division supplies the frontal lobe and the superior part of the parietal lobe, whereas the inferior division supplies the inferior part of the parietal lobe and the superior part of the temporal lobe. This is the MCA anatomy. The M1 segment, it gives the lenticulostriate branches, and then we have the two M2 branches, that is the superior division and the inferior division. Okay.
So are you understanding this? All of you, are you understanding about how it goes and supplies? This is another video which I would like to revise again, but this is very important.
The superficial divisions, namely the superior and inferior branches, supply the lateral parts of the primary motor and somatosensory strips. However, in the dominant hemisphere, which is by far most commonly on the left, the superficial divisions also supply Broca's and Wernicke's area, which are crucially important in producing and planning speech. In both hemispheres, they also supply other association areas which have less well-defined functions, but include spatial awareness. We can now piece this information together to predict the symptoms from an MCA.
So now, in this particular slide, it is showing that the middle cerebral artery is supplying this particular area, which is the primary motor and the sensory cortex. Okay. It's a primary sensory cortex. So anywhere where there is a sensory integration which is happening, the sensory innovation which has been perceived in the cerebral cortex, that particular area is here, which is supplied by